Welcome back to the studios of Hala, Kuwait, dear viewers. We have been joined by our first guest for this evening, Dr. Faye Alabdulghafour, MBBS, Masters in Clinical Neuroscience at King's College London and resident in neurology. Good evening, Dr. Faye. How are you doing?
Hi, I'm good. Thank you so much for having me.
Thank you. It's our absolute pleasure, especially that we're going to be talking about brain strokes. And I noticed it's not a topic that people do bring up a lot.
Yeah, and I'm happy I have this opportunity to shed some light on the situation and just raise some awareness about the topic.
Definitely. So can you explain to us, what is a brain stroke?
So a stroke is an acute event where you have a sudden disruption of blood flow to the brain. It's very similar to a heart attack, but that it happens to the brain.
Right. Okay, so it seems pretty serious off the start.
Yeah.
So how does it happen, or why does this happen with people usually?
Okay, so we can break down the question into how it happens and why it happens.
Right.
So firstly, how it happens, there's usually a blood clot that comes either from the heart or from other arteries around the body. Most commonly, there's something called the carotid artery that's around the neck. And this blood clot travels all the way to the brain. It disrupts the blood flow, and then the brain is deprived of oxygen. Why this happens, there are some risk factors, some that are non-modifiable, some modifiable. Some non-modifiable risk factors include age and gender.
Right.
Some modifiable risk factors, the single most common risk factor is high blood pressure, which isn't talked about enough, and other things like diabetes and high cholesterol, and finally genetics.
Yes, so Faye, you mentioned age. Before we talk about the symptoms, with brain stroke, should we just expect them with older patients, or is it a possibility for young patients to have brain strokes, I guess?
So there definitely is a possibility of young patients to have brain strokes. We've seen quite a few patients. With the younger patients, there's usually a more, different cause. So it's not usually your blood pressure, hypertension, diabetes and cholesterol. We're seeing a lot of, unfortunately, younger patients use things like anabolic steroids for muscle building at the gym, as well as genetics. So there's like a whole workup for stroke in young cases.
So I think we should definitely watch out with the things we do put into our bodies when it comes, as you said, to the gym, because that's very common.
Definitely.
So what are the symptoms or signs that someone is going to be having a brain stroke and we should go to a doctor as soon as possible?
So there's a very nice mnemonic that I like to share with everyone, and that's called B FAST. So B stands for balance. Some patients getting a stroke have the feeling of vertigo, where the room is spinning around them. The E stands for eyes. Sometimes patients are unaware that they have visual problems. Sometimes if they had a brain stroke on the left side of their brain, they might completely ignore the right side of their body. Or sometimes they might even have unilateral, which is one-sided eye loss. In addition to B, so we're moving on to the F, which is face. Sometimes patients have the facial droop.
Right.
The easiest way to recognize that is ask the patient to smile. And if the smile is very asymmetric, that's one of the symptoms. A is for arms, so arm weakness. S is for speech. You might have trouble understanding a patient who has a stroke.
Right.
And finally, T is for time. So time to call the ambulance, time to call, and time to record when you last saw the patient well.
Right.
That's really important because within 4.5 hours, we sometimes can use an alternative form of therapy called thrombolysis.
Okay, perfect. So with all these symptoms, do they occur on the spot, or does it really lead up to the actual brain stroke?
So it really happens on the spot. That's one of the ways for us to differentiate strokes from other symptoms.
Yes.
Usually from the time that the symptoms start until the maximum onset of symptoms is seconds or minutes. It's not longer than that.
So it's very fast.
Very fast. That's why it's an acute event.
Makes sense. So can someone fully recover from a stroke, or is it something that the patient has to be going to the doctor for a long time? You know, a lot of doctor visits, upkeep, medication. How does it work?
So it really depends on the type of stroke that the patient has. It's very difficult to answer that question on its own. Starting physiotherapy very early on is a very good prognostic factor. So the first few days within or weeks within developing the stroke, that will increase the chance of recovery through rehabilitation. Generally, we have 3 types of rehabilitation. Firstly, occupational therapy, which maximizes the patient's independence and activities of daily living, such as putting on your clothes, buttoning your shirt, cooking for yourself. And then we have speech therapy. And finally, we have physiotherapy, which allows you to gain motor function back in that you've lost. So to answer your question, some patients end up with severe disability, and some patients can recover fully if the stroke was very minor. So it's very diverse.
Definitely. So it's case to case in the situation.
Basically.
So what happens if someone actually ignores the symptoms? And I've seen that happen so many times. Some patients are like, it's fine, I'm okay. Maybe it was, you know, a 5-minute thing, and they would go on just ignoring it.
So it's really important for you to never ignore symptoms that are serious, especially when it comes to stroke, because the chances of someone developing a stroke within 5 years of them having a stroke initially is 1 in 4. So that's around 25% of patients. And what we like to do is when a person does develop a stroke is to minimize or perform secondary prevention. So we need to control their diabetes, their high blood pressure, their cholesterol, and we need to look for why the stroke happened in the first place. Sometimes patients have something called atrial fibrillation, which predisposes you to developing a clot in the brain, or sometimes they can have carotid atherosclerosis, which can develop a clot in the brain.
Definitely. So what can someone do to help the patient that's having a brain stroke in the moment? Because this could happen to any of us at home, you know, to our family members. So what can we do on the spot?
Firstly, I'd say don't delay coming to the hospital. So when a stroke happens, time is of the essence. You really want to get to hospital as soon as possible to try and get the CT scan. And something else, don't panic. So try and keep calm. While you're on the way to the hospital, you can sort of recollect or make a summary of the relatives' past medical history, so what sort of medical conditions do they have, a list of their medications, just so it's easier for the doctor to take a history upon their arrival to the ER.
Definitely, because the patient needs to be helped out like really fast. Perfect. Dr. Faye, I think you did a great job helping us understand brain strokes and what we can also do to help the patients experiencing them. But do you have any final advice for our viewers?
So just to really get good control of diabetes and hypertension, they're 2 of the single most leading risk factors for developing strokes. They're very insidious. You might not get day-to-day symptoms from having these conditions. However, in the long term, getting a stroke is detrimental to someone's health. So I would really recommend getting that under control.
That's very unfortunate. Hopefully no one will have to deal with that. But thank you so much for being with us this evening. Thank you. Dear viewers, we had with us Dr. Faye Alabdulghafour, MBBS, Masters in Clinical Neuroscience at King's College London and resident in neurology. Up next, we have a report